Okay, thank you everyone. Welcome to this webinar, which is jointly being organized by QII International Society for Telemedicine and eHealth, ISfTEH, which is one of the largest, I would say, association in this field, and most importantly, at the global level, in official relation with WHO, the World Health Organization, and set the benchmarks for telehealth medicine and digital health and emerging technology areas. So we are very delighted on behalf of QAI and behalf of ISfTH. We are very much delighted to welcome you all. Today in this special webinar, we have very eminent speakers, including coming from ISfTH itself and couple of member organizations who have very kindly agreed to join this webinar and share their words of wisdom. And I think the very special what I mentioned is because we are celebrating World Accreditation Day. And for those who may not be aware of, the World Accreditation Day actually is very unique to healthcare. And I'm very proud to say personally that I have been very instrumental in initiating World Accreditation Day a couple of years back, or in 12 years back in healthcare for the first time. But primarily, the World Accreditation Day is actually celebrated since 9th June 2008. And it is the brainchild of two organizations. One is International Laboratory Accreditation Corporation, ILAC, and International Accreditation Forum, IAF. These two international organizations are the recognizing bodies for accreditation bodies in ISO scale, where the ISO standards are used for accreditation of testing lab, medical laboratories, and also certification bodies for different types of certification. So its genesis start from 2008. So now it is 18th year of celebrating the World Accreditation Day. And we are very happy. We celebrated on 9th of June. But this is very special because we bring again a international community to this. And most importantly, the theme of this year's World Accreditation Day is very unique and which is very, very important and linked to ISfTH. The theme of this year is innovation, trust, and sustainability, the power of accreditation. So these keywords about innovation, trust, and sustainability. So innovation is always a part of technology-driven society and technology-driven systems. And ISfTH plays a key role in that and creating innovative products and services for the community and the mankind. And then trust. Obviously, trust comes from certain benchmarks, and accreditation has been a very important tool and mechanism to create trust amongst communities and societies for either buying a service or buying a product. And it has been very well established in last several years. And then comes sustainability. And I think everywhere around the world, people are talking about sustainability, and healthcare is not exception to it. Healthcare providing solutions for sustainability. Healthcare is also creating some problems for environmental sustainability, but also the sustainability issues are impacting health of everyone, whether it's a human being, animals, or plants. So as a planet. So I think this topic and theme is very, very important for this year's World Accreditation Day. And I'm very pleased to have several eminent speakers coming and joining this. I personally welcome Professor Yunkap Kwankam, who is the Executive Director of ISfTH and a global leader of digital health, have been in this field for decades and have been showing the path to younger generation and organization to lead it. We have with us Dr. Sean Griffin, President and CEO of URAC, one of the oldest and largest accreditation body in US, specifically in the area of telehealth and digital health. We have Dr. Alan Taylor, who is the chair of Standards Australia and IT 01420 Telehealth Management Subcommittee. He is also a convener of ISO TC 215 Health Informatics Task Force on Telehealth and Virtual Care. We also have with us Dr. Ruhina Khan, who is a Business Development Manager for Healthcare Accreditation with AAA, which is American Accreditation Association. Very pleased to welcome Mr. Raymond Verrett, the CEO of Telehealth Certification Institute from US, and also welcoming Ms. Maya Sharne, General Manager, telehealth.org. And nonetheless, very dear friend, and colleague Frederick Levens, Vice Executive Director of ISfTeH, who has been very instrumental in putting this show to us for last several days. Thank you, Frederick, for your support to make this happen. And I think not taking much time now, I would like to now first welcome our first speaker, Professor Yunkap, to open up and give us an overview of ISfTH. Over to you, Professor Yunkap. Floor is all yours. Thank you very much.
Thank you very much, Dr. Rana. Mine will not so much focus on, we'll focus on ISfTH, but more narrowly on the work we do in this area. So it's really an honor and a privilege for me to welcome a worldwide audience, if the registration numbers followed, to this celebration of World Accreditation Day. As you pointed out, we're a few days late, but the event is nonetheless relevant as an important contribution, not only to the theme, but to the cause of accreditation. When I hear the word accreditation, what immediately springs to my mind is another word, quality. In the 2018 joint report by WHO, OECD, and the World Bank titled Delivering Quality Health Services, a Global Imperative for Universal Health Coverage, accreditation is positioned as a core external assessment and guidance tool. It serves to standardize and systematically improve clinical quality in ways that include defining quality standards, creating accountability, and enabling quality of care in universal health coverage, embedding, I should say. In the 8 years since that publication, the landscape of digital health has been transformed by advances in artificial intelligence, the Internet of Things, blockchain, large-scale telemedicine deployment, and advanced analytics and interoperability standards. A 2028 update is therefore being planned and is currently under development. This is both, as I said, timely and necessary. Now, the International Society for Telemedicine and eHealth, in its capacity, and you've alluded to it, Dr. Rana, in our capacity as a non-state actor in official relations with WHO, is uniquely positioned to contribute to this update of the 2018 quality report. With a global membership spanning clinicians, researchers, health informaticians, policymakers, and industry experts across more than 50 countries, the Society offers both technical expertise and practical field experience across the full spectrum of digital health innovations relevant to quality of care. The Society, therefore, will welcome both. We look forward to leveraging your skill sets and experiences in contributing to the update of that report. We're also already working on some basic innovation training courses online that will come on, I think will be published later this year with telemedicine.com. And we will hear shortly, as you've been told, in this webinar from other ISfTH members, notably telehealth.org and Telehealth Certification Institute, about the courses that they offer already and available for you. On behalf of the entire ISfTH community, therefore, I wish you all a very fruitful exchange of information and experiences and productive deliberations to further stimulate the effective contribution of accreditation to the attainment of the health SDGs. Thank you.
Thank you very much, Professor Income, for your word of wisdom and giving us an oversight of what's going on and how we can really leverage on the power of technology and use the society as a platform to grow and improve. So thank you so much for your presence and sharing your words of wisdom. Moving on to the agenda next, I would welcome Dr. Sean Griffin, who is a well-established physician and running the largest and oldest, accreditation organization in the United States of America, URAC, and brings a lot of wisdom. And he's going to talk about innovation and digital. So over to you, Sean. Floor is yours. Thank you.
All right, can you see my slides? Are they still stuck in presentation mode? Okay.
Yeah, we see them. Yeah, now it's full presentation.
Great, thank you.
All right, thank you very much. I really want to thank you all for the invite. I come to you this morning in Washington, D.C., where we have a bit of a unique view as to accreditation and the goals for accreditation in the United States. Today, I really want to focus on something around trust. Trust is really sort of the main issue that we're dealing with right now in the United States. The digital aspects, we saw the boom during the pandemic, where all of these telehealth uses were suddenly thrown into usage during telehealth. Some of that has dialed back, some of it has stuck around in the United States. But right now, what we're really facing is a real consideration as to what trust means. And artificial intelligence is very much under the microscope in the United States and what it means to healthcare in general. So a bit of our background, we've been doing accreditation for over 35 years. Our accreditations focus on education and quality improvement, nothing unusual there. We also accredit everything from little organizations with less than 10 employees all the way up to multi-state insurance plans. That means that when we set standards, our standards have flexibility into how you reach those standards, but there is no flexibility as to what you achieve. It's about how you get to quality, and that's incredibly important for us. We accredit organizations in the US, also internationally. We have the first AI in healthcare accreditation in the United States, which we rolled out at the end of last year, which is currently you have organizations going through that. And our avoiding of conflicts of interest in the United States has actually caused us to be named Best in Business each of the past 2 years by Modern Healthcare Magazine, which we think is quite the compliment. We were the only accreditor named last year for that achievement. So as I said, the focus for my few comments today is that innovation is moving faster than the trust behind it. We have a very unsettled feeling towards AI in healthcare and AI in general in the United States. There's concern about jobs, there's concern about trustworthiness, and what we're seeing is that AI is very focused on health tech, but not necessarily healthcare. There are some bad actors in the market in the United States who are rolling out tools that are probably, I'd say I compare them to an overconfident third-year medical student. They have a lot of information, but not necessarily wisdom. And so as we look at how this plays together, AI is rolling into telehealth and digital health, and patients like parts of it. They're not sure about other parts. We actually have some lawsuits in the United States because there is a lack of regulation. We have some states who have put forth regulations. And as I often say, litigation fills in the gaps when you're waiting for regulation. The lawyers are faster than the legislators. And so we have lawsuits in several different areas. We actually have a state that is suing a chatbot for saying it was a doctor when it wasn't a doctor. But we don't want to throw out the good just because of concerns about this. So how do we actually know that services are safe and effective? How do you manage privacy? How do you look at equity? How do you manage risk? And how do you protect patients and providers during this time? We have providers who are having tools rolled out to them without their say, without their involvement. And how do we manage that? So when we build our programs, and we have over 40 different programs, we try and be very clear in our standards. We put out our standards on the web, on our website, to be best practices. But I say that best practices without independent verification are like a New Year's resolution, where you say you're going to work out and exercise, but come February, you're probably not visiting the gym very much. And when it comes to healthcare, saying you're going to do your best has never been good enough. And so we look at independent review, we look at governance and oversight. Ongoing quality improvement is always part of an accreditation, but then also that external credibility. We talk about, because there are bad actors, the saying in the United States is that right now AI and telehealth is still a little bit of the Wild West, and we need some more sheriffs. We need some more people who can patrol and say what's going on is right or what's going on is bad. It's not intended to slow innovation. It's actually intended to give the guardrails to protect patients and providers while innovation continues to zoom forward. And that's why we believe that accreditation, whether it be in telehealth or AI, is complementary to what is going on when it comes to innovation. We want patients to have all of the access, all of the opportunity, all of the information that they can, but we know that it needs to earn the trust before it can be trusted. So as I said, we're no longer that focused on the technology when it comes to telehealth. We have pretty good technology, and our cell phones put the powerful computers in our pockets. But now it's about, can you trust what you see? And AI has changed that, whether it be in medicine or whether it be on videos. I'm pretty sure that not many cats can actually play the piano, but the AI videos that I see on a regular basis sure make it look like they can. And I think that same risk and concern applies to healthcare. So we put our standards out there. We're moving forward with them. We're on our 4th version of our telehealth standards because we've been doing telehealth accreditation since around 2016. And we look forward to speaking with any of you. Feel free to reach out to us. The United States is sometimes ahead and it's sometimes behind, but we're moving along with accreditation. And I just want to thank all of you for giving me the time to talk about what we're doing at URAC. Here is my email address. It's sgriffin@urac.org. And just honored to have the chance to speak with you today and to hear from others. So I'm going to pop off of screen sharing and I'll see if there's any questions, but I think I can move on now. Thank you very much.
Thank you, Sean. Thank you very much for a very crystal clear presentation, as always, sending the strong message in minimum words. Thank you so much for that. And I think you aptly mentioned about trust. And this not only, I think, United States and everywhere globally, including India, the questions are being asked on even accreditation systems, how the accreditation system works and how they are able to, enforce their requirements over their accredited organization on a continuous basis, so that you can fish out the bad fishes, and not malign the entire pond for that matter. So I think and that's why I think the role of technology slowly, I think, would take a place where we can have some system developed and start monitoring without physically visiting facilities, how they are really operating and how they are complying to standards on continual basis. So thank you very much, Sean, for that. Moving on to the next agenda, and I think this is me who is going to talk about QAI initiative on telehealth. Just me. Okay. Are you able to see my screen? Yeah, thank you. So I'm quickly running through QI's telemedicine accreditation framework, which we have developed. So QI is an accreditation body with global recognition in healthcare space as well as in laboratory space from ISO World. We offer accreditation programs for the whole patient care continuum, pre-hospital, hospital, and post-hospital care. We are operating currently in 16 countries as a whole, QA in different programs, including the laboratory accreditation. And we are accredited by International Society of Quality in Healthcare External Evaluation Association. Long name is QIEEA, which is seen as accrediting the accreditors. These are some countries which are operating. North America, yes, is left out, and then South of America, but yes, we are spreading across. We offer 22 programs at the moment, as I mentioned, starting from a single doctor clinic to a tertiary care hospital, and then home care, including telehealth, which is for pre-hospital and post-hospital, and many other specialized programs like IVF, hair transplant, bone marrow transplant centers and IVF centers, and so on and so forth. We are coming up with 2 standards for headache clinic and one of our Indian traditional system of medicine, which is now gaining a lot of momentum across the globe, particularly Ayurveda. So not only just treatment, but the wellness side of it, preventive and curative system of medications. Telehealth, telemedicine, yes, they are slightly different as per WHO definition, but quite frequently used interchangeably is use of technology platform to deliver healthcare services to a certain extent, not replacing the on-site visit or on-site contact with the patient and doctor for receiving care. And so far, there are 4 modalities of telehealth services identified. Basically, is patient to provider through caregivers, and healthcare workers to provider, and provider to provider for seeking second opinion. So any of these modalities can be, explored and manipulated for using telehealth services. Couple of, I think 5 years ago, we developed, just during COVID time, we developed telehealth accreditation standards based on some fundamental principles of organizational excellence and technology-driven systems. So the framework comprises of 10 chapters, 61 standards, and 239 measurable components. And if you look at this slide, this gives an overview that it takes care of the governance and leadership to all the down the line. So first 5 are organization-based standards, and the rest of the 5 are basically patient-centric standards, which actually talks about different aspects of patient. So governance and leadership basically talk about how the organization is governed, how the management is institutionalized, the system, and quality and safety journey is actually being led through a top-down approach from the leaders of the organization. And the human resource management is basically talks about the entire process of human resource management, starting from what you need, how many you need, what you need in them, and how you will get them, So defining qualification, experience, skill metrics, and the adequacy in numbers, and then how you get them, the recruitment process to provide those services which you are aiming to offer through telehealth services. And facility and risk management. And as we know, the telehealth actually is very uniquely positioned as compared to a hospital setup where the physical building exists. But now we are moving toward the virtual care, even virtual hospital started coming up. And telehealth is offered either through a totally technology-based platform. It's maybe on the cloud with no physical office space, and maybe hospital-based telehealth services where there's a hospital and then they set up the telehealth platform within the hospital. So depending on where it is being operated, then facility is looked after because of safety concern. Somebody is occupying a place, a physical place needs to be safe. And how the equipments and everything is actually managed, that takes care of in India. Information management is the key for any standard, including telehealth. And in fact, it is more important in telehealth system because of many regulatory constraints at the moment in India, including India. We have now Digital Personal Data Protection Act, where if you collect any personal data of individual, then you are liable to be protecting it. And in an Information Security Act, Information Act. So what is the information in your contracts as a telehealth service providers to define first, and then how you collect that information, how you store that information, how you retrieve that information when you need them, and how you dispose it off when you no longer require, because you can't continue keeping the data and information, whether it's a paper form or electronic forms. Particularly in telehealth, we're talking about the electronic data or digital data and information. So there is a limit to keep it. But the most important thing is to safeguard it from the intruders, to protect the confidentiality, integrity, and safety. So all these things, how a telehealth provider in their system make sure that the information which is captured, which is related to the patient and the doctors who are providing care, are really taken care of through different mechanism of authority and restrictions to the systems. The continual quality improvement, I call it a master chapter because it drives the organization on continual quality improvement journey, whether it's a managerial part or a clinical part. So it requires organization to define certain quality indicators which are measured to know a simple like patient satisfaction rate, for example. even turnaround time for providing a specific services, complaints, how you handle them. So there are certain indicators, and depending on the complexity of the telehealth service platform, you can add whatever you would like to add. But basically, this is to overview and give an opportunity to the organization to self-assess before external organization comes and review and accredit. You do your own self-evaluation and see how you are moving towards that goals and objectives you have set for yourself. And patient assessment and care, again, this is the clinical thing. When patients seeking any teleconsultation, how they get registered on platform, what is the mechanism provided, how do you ensure the identity? When it's a virtual world, like we are able to see each other in the video, obviously. But if there is no video, it's only just audio, or even just messaging like WhatsApp text message or any other platform. How you ensure I am Dr. Rana seeking the advice? I may be anyone else. And how I know that Sean is my doctor providing me the consultation? Maybe Sean, like gave an example of AI, has put an AI chatbot and responding to my queries. So it is very important to identify the service receiver and service provider. So how it is done, and then patient assessment, that how you assess the patient for the problems, and then provide the care plan and also on. So it's a very, very important things. Obviously, these are fundamental things for any patient rights and education. So this is also very important to educate patient that what they are supposed to do, what they are not supposed to do in terms of even disclosures, certain disclosures to seek help. You need to disclose that, yes, if doctor asks questions, you need to, in a very ethical manner, you have to disclose. And obviously, rights are certain basic fundamental thing which need to be conveyed to the patients, and they are there too. I think in telehealth, the world has grown a lot. United States has even gone on even after COVID. Telehealth has gone beyond teleradiology, telepathology, tele-ICU, and so many tele things are being done using digital technology. But in Indian context, when we started telemedicine practice guideline in March 2020, after COVID, the government has actually, before it was not legally allowed, and it become legally, but it's still restricted to certain medical prescriptions. You can't prescribe some medications which might have risk, because you are not seeing patient in person. So there are some restrictions. But how, and this is very important, because medication errors are happening around the world, and these are the medication errors are the second largest component of all medical errors. And that's why WHO has given a specific mention of medication errors, prescription prevention aspect, how you prescribe, how you transfer medication orders, and so on and so forth. Hygiene and infection control, I think, depends on the nature. If it is just a cloud-based system, there is no the facility, it doesn't come into picture. But if it's a hospital-based provider, then certain aspect of infection prevention comes. Otherwise, it's not much relevant. Yes, last but not the least, digital health applications, very, very important. Whatever digital health platform you use, how you ensure the integrity, safety, are you compliant to national and international regulations? Are you compliant to the data operability, transportability? Whether the machine talks to each other. And I heard a lot of people are talking about digital health, and I am afraid whether they really understand what digital health is. Most of the people take digital health as for the electronic system. They consider digital health, but their system do not talk to each other. One digital device is not talking to another digital device. Then it's not a system. So this chapter actually gives requirements and how data interoperability and all these things happens and work together. So I think this is something very, very thick. And I think I have a surprise. I'm surprised. We had this in mind to launch on our 9th of June of World Accreditation Day. But when this came to mind that this is going to happen on 12th of June, so we thought, because we have a standard for telehealth service provider, we also developed standards for telehealth platform, which are used by the service provider. It's more on technology part to deliver the services. So we developed, and I take this opportunity humbly to request Professor Yunka, who has been a leader in this field, to please announce the launch of these standards for us. So may I seek your permission, Dr. Yunka, for playing a video for this launch? May I have your permission, sir?
Definitely. Please go ahead.
Thank you so much. Thank you. A very quick video. Thank you very much, Professor Yunkap. Thank you very much. And we thought that this may be a good opportunity because people are coming here. So we did not launch it on 9th of June and we parked it for. So thank you everyone for witnessing this occasion. Thank you so much. Now moving on to the next agenda. I have the pleasure of inviting Dr. Alan Taylor. As I already introduced him as Chair of Standards Australia and have been very instrumental in the field of telehealth global level, participating in ISO technical committees on health informatics, task force and virtual care. He is going to talk about some update on ISO 13131, which is a standard for telehealth services in quality planning guidelines. So our floor is all yours, Dr. Taylor. Thank you so much.
Hello, good evening, and thank you very much for the invite. Can everyone hear me?
Yes.
Brilliant. Okay. I'll share my presentation. Okay, that's good. Right, well, you may or may not gather that I'm actually based in Australia, where we have had a very lively telehealth and virtual care scene for more than 25 years. But in the role in which I'm speaking to you about, I convene the ISO TC215 task force on telehealth and virtual care. So ISO has had a long history in setting the agenda for quality telehealth services starting in 2014 and moving on to a full standard in 2021. And that standard, ISO 13131, is a standard to help people develop guidelines for quality and safe telehealth services. It's not a standard against which you should be accredited, but it can be used, it has been used for accreditation. But 2021 is a long time ago in the scene of things, and that standard is due for revision. And the task force recommended, in fact, it be replaced by a management system standard. And I'll explain later what a management system standard is in ISO terms. And that will be supported by a maturity model to help people reach certain standard levels, certain quality levels, certain safety levels in the virtual care that they provide. So those two standards will together provide a basis for large and small, even single provider organizations to improve the quality and safety of their services. There we are. So, the key thing is in safety and quality. of virtual care is the management of processes, the management of healthcare, and management of the supporting technology. And the standards that we're looking at and the standards that we've been talking about today really form part of a really complex ecosystem of standards, and there's standards for medical records and so on and so on, the standards for artificial intelligence systems and so on. The standard that ISO will develop, which is called ISO 13101, will support national systems, support organizational practices for telehealth and virtual care. What we're seeing worldwide is a huge growth, particularly since COVID, in the number of countries who have national laws or guidelines on telehealth, particularly in Europe and the Americas, but also in Western Pacific and to a lesser extent in Southeast Asia. So you can see that there is a lot of interest internationally in telehealth and virtual care. The scope of the standard that ISO will be developing, it's not surprising. We've already heard in this seminar many of these issues require standardization. It's about management, about processes, about how you look after people, both the workforce and care recipients, patients, consumers, whatever you want to call them, your financial resources, the information technology, and the planning and provision of human resources, infrastructure, facilities, technology, upon which telehealth and virtual care services do depend. I mentioned that this standard will be a management system standard. It will, in fact, be a sector-specific management system standard, providing requirements for virtual care and telehealth services. So management system standards are not a new thing. You know, one of the earliest ones was ISO 9001, but there are others relating to technology services such as 20001 and in-person care such as ISO 7101. So the standard that we're going to write, and I'll tell you about that in a minute, will be part of a larger family of ISO standards. And if you've got accreditation to ISO 9001, you'll be very familiar with this and able to quite easily understand what's required in the telehealth and virtual care space. One of the problems we see worldwide, and I'm talking about worldwide application of standards, is that there are a lot of guides. There are codes of practices, there are statements, investment guides, a lot of work done by the WHO, which is very high quality. But none of these guidelines are really certifiable. They're not written to be certifiable, and we'll come to that. So why is an international management standard for telehealth and virtual care needed? It's needed because of the things that I've alluded to. There's been a huge growth in private and national ecosystems, virtual standards and accreditation. We have several of those organizations on the webinar today, and that's absolutely great. We're all part of the same ecosystem. What ISO seeks to achieve is reduce barriers to trade and improve global, in this case, global healthcare safety. ISO also wants to enable lesser resourced sectors, countries, organizations, obtain certification in the provision of virtual care. That's a very important consideration, that we don't forget people who don't have the same access to resources that others do. So ISO 13101 will be able to be used for self-assessment. It will be able to be used by an industry body or association for accreditation. It will be able to be used by many of the organizations providing accreditation services who are in this webinar. And the highest level of conformance assessments means that an organization that's doing the accreditation has to have assessment to the ISO 17021-1 Management System Certification Standard. We're going to ensure that, as I mentioned, that the main standard is going to be supported by a virtual care maturity model, which will be a separate standard. And this will provide a framework for a maturity model. And that maturity model can be used to evaluate the capability and governance and improvement level of telehealth and virtual care services against defined stages. And it will provide measures and advice to support that work. There are a huge number of related standards and recommendations, both from ISO and other organizations, and I've listed some of those there. The standards around concept support healthcare, standards around medical devices, standards around risk management, standards about accessibility, and standards about information technology. So you can see it's a complex area. The standard that we're developing in ISO won't attempt to replicate those, but it will refer and draw on those standards so people know where to go if they need some specific guidance, say over cybersecurity or artificial intelligence for that matter. Timelines for this project are that it started. Between this month and November, we hope to finalize a committee draft, and ISO has defined stages, including a lot of consultation about standards before they're finally published. There'll be a draft available for translation in May next year, and then there'll be more ballots to see if people agree or have comments, want changes, be published in 2028. So that's about a 24-month timeline. And the maturity model standard will follow a similar schedule, but probably delayed. We would really sincerely welcome the participation in the project group of people who have expertise and organizations who have expertise in telehealth and virtual care standardization and healthcare in general. So we're going to draw on ISO technical committees that have an interest in this area, and there are several of them. We're certainly going to draw on representatives of liaison organizations to 2C215, for instance, WHO, EMEA, and I shouldn't forget the ISfTeH, which is one running this wonderful webinar. You can participate through liaison organizations such as the ISfTeH or WHO or EMEA, or you can get yourself appointed as an expert by your national standards body. If you'd like information about how you can get involved, contact the 2C215 Secretariat, or indeed contact Frederick, who will be able to point you in the right direction, and we can get you involved. I just thought I'd add just at the end, because I am from Australia, but there's a lot happening in Australia on telehealth and virtual care. It's being taken very seriously at the federal government level. The Australian Digital Health Agency has established expert advisory groups on telehealth and virtual care and also artificial intelligence. Standards Australia is taking a look at, well, more than take a look, it's going to issue a standard on the consumer perspective. What does the consumer need to know if they're going to use telehealth and virtual care. Very important and a neglected area. And also in the area of rural and remote use of virtual care, the Australian College of Rural and Remote Medicine is going to publish a standard on virtual care, which hopefully can be useful internationally as well. That will be a public standard. Thank you very much.
Thank you very much, Dr. Allen, for a very nice overview about ISO 13131 and related standards which TC 215 is doing. And I think it's exciting time, and I'm sure ISfTH would be very happy to be associated at because getting an expert through a national standard body is a very challenging task. Depends on who they want to appoint and nominate. So this is another area where you can be a licensing member. So ISO TC 304, working group 5 who developed 7101, I was very lucky to be appointed through ISQA as a licensed member and wrote that standard. So I think Dr. Yunkap and Frederick is here. So we will explore to join some of the committees through ISTH and having a representation there. Thank you so much for wonderful information. Moving on to the next, I would like to welcome Dr. Ruhina Khan. She's the Business Development Manager for Healthcare Accreditation at AAA, American Accreditation Association. She's talking on accreditation in digital health age, building trust in virtual healthcare. So over to you, Dr. Ruhina. Thank you.
Thank you so much. Thank you so much, Dr. Rana, for the introduction. Let me quickly share my screen and please let me know when you can see it. Yep. Can you see my
Yeah,
screen?
it's coming up. It's coming up. Yeah.
All right.
Just in the slideshow mode. Yeah.
Yeah. All right.
Yes.
All right. Hello, everyone here. Thank you for the invitation for this lovely webinar. I have thoroughly enjoyed myself being on this panelist with like-minded people. And today I will be sharing my insights on the power of accreditation, especially in the digital age post-COVID. Let's start. So while I was also listening to Sean, I could think about a very interesting analogy. I'm not here to actually tell you something new that you don't already know. You all are industry experts, but I'd like to share a very interesting analogy before I start my presentation. I think a good accreditation standard actually is like a bridge. Imagine imagine what it's worth by its design. It's not worth by what is designed on the paper, but its ability to actually safely and reliably carry people across. Okay, so similarly, what sets standards apart is not the number of requirements that the standard contains, or how well organized or the standard is, or how long the standard SOPs are, but by how well organizations can actually adhere to them. The true strength of the standards actually lie in the practicality, the industry acceptance, and the trust and sustainability that they bring to the accreditation ecosystem. So I think that's a very interesting analogy that I could think of after I could hear Sean speak. Thank you for that, Sean. Moving on, I think let's consider a scenario. A patient consults a cardiologist on the phone from a rural village, and a therapist supports a veteran across 3 time zones. A radiologist, reads a scan uploaded from another continent. This is the kind of healthcare that we're experiencing today, which is boundless, borderless, and it's growing fast. But with that boundless reach, it comes a very critical question that how does a patient know they can trust what they cannot see? That's when the accreditation comes in. All right. Let's have a look at the numbers. I'm someone who has hated numbers right from my childhood until adulthood, but after coming into business, I've grown to like them so much. So let me share quick numbers with you, especially after the pandemic. We have seen rapid growth that has also introduced serious quality gaps in the landscape of teleconsultation or telehealth, right? we've seen about a 38x surge in telehealth use post-COVID, which is 2020. We've seen that 1 in every 4 patients report inconsistent virtual care experience, and about 60 plus countries with fragmented tele-regulations. Right, traditional markers of trust, a hospital, which is a hospital, a license on the wall, which simply does not translate to a video on the screen. Right, so patients now face unverified providers, inconsistent data privacy, and no reliable way to access these qualities. Like Dr. Rana said, that it's important that even the systems get to talk to each other, wherein interoperability comes into play. This is exactly how you can bond cross-border bonding with one system to another, while also preserving the confidentiality of the patient data. Right. Now let's see what accreditation does in a virtual world. Accreditation has always been healthcare sector's trusted infrastructure. Now imagine a scenario where where all the IT collapses in the world or AI collapses in the world. Will your organization still be able to sustain those quality standards, those improvement standards, corrective action plans that were initially suggested to you by these accredited organizations? It's something that you can ponder about in a bit. But let's move on to accreditation. Has always been the healthcare sector's trusted infrastructure, and why? It is because it verifies and identifies the competencies. It creates accountability, wherein accredited organizations submit to an ongoing review, and it's not a one-time pass, or it's not a checklist that you have to clear. Accreditation organizations have to ensure that there's continuous quality improvement, and the standards that are put in place are sustainable to adhere and to maintain. Now, it also enforces data security standards, especially now when there's ransomware and there is cyber security attacks and so on. I think it's a very important standard to put in place, which ensures patient information is handled with the same rigor in a digital consult as in a clinical room. And then, of course, it builds a payer-patient confidence. It means that the insurers, regulators, patients all use accreditation as a reliable shield, which is independent signal of quality of care. Moving ahead, accrediting virtual care. That's when my organization comes into play, and I will quickly give you details of what we do. At the American Accreditation Association, we have evolved our standards to reflect the realities of modern healthcare, which delivering including where care is delivered even digitally, and not just on site as well. Give a quick summary of the standards that we've developed by a very competent team of healthcare technical team that we have in place. We have something called as a virtual primary care and specialty consultation. We have cross-border multinational digital health organizations, behavioral health and teletherapy providers, telediagnostics, teleradiology and remote monitoring, AI-assisted clinical decision platforms, and eHealth and mobile health apps. This is the comprehensive of what the standards would look like while you're getting or planning to get your facility accredited in telehealth consultation at AAA. Now, the road ahead, actually, it must keep pace with the digital innovation. We have AI-assisted diagnostics, where the algorithm flags a condition and then who is held accountable. AAA frames must define governance standards for AI use in clinical decisions. Like it's the sheriff that catches the bad guys. Coming to cross-border care, a patient in one country receiving care from a provider in another country, for example, raises a complex jurisdictional question. So the international standards come into play, where cooperation is essential from both parties. Then comes the health equity, which is very essential and very fresh perspective, wherein digital accreditation must not create two-tier systems. Standards should expand access to quality care and not restrict it. So our goal is to grow with the organization, to actually guide them through the sustainability of the standards and not restrict them. Now, AAA has also actively collaborated with international partners to harmonize this particular cross-border accreditation standards. Now, coming to the very important aspect, not not something that you don't know of, but here's my perspective. Trust is the product, right? Every industry that has scaled digitally, such as banking, aviation, e-commerce, had to solve the same very problem, which is how do you build trust when you remove the human from the room, right? AI really cannot take all of our jobs, all right? In healthcare, the stakes are higher than any other industry because accreditation is the mechanism by which we protect the patients who can no longer see their provider's diploma on the wall because now it's just a screen, right? Coming to my conclusion statement, on this World Accreditation Day, I think we all must commit to a future where every virtual care interaction is backed by the same rigor, same standards, and same accountability as the best physical care in the world. Now, I've been actively talking about digital health standards, innovation in digital health. I've written various educational articles as well. You can find it on our page. Please visit our website. You'll find all the articles in place. And if you want to have a chat, I'm always available for it. You can email me, get to know me on LinkedIn or from our website, and I'll be really happy to have a chat with any one of you here. I think that's my time. I will.
Thank you.
Any
Thank you,
questions?
Ravina.
Yeah.
Thank you, Ravina. Thank you very much for wonderful presentation. Very quick overview of thoughts and how people can leverage on that information which you have provided insight about. So thank you so much. Moving on to the next speaker, may I now welcome Raymond Barrett, Chief Executive Officer of Telehealth Certification Institute, talking on online continuing education and training for healthcare professionals. So over to you, Raymond. Thank you.
Excellent. All right. Thank you so much. And I'm really glad to be able to present and be here with all of you. So I'm Ray Barrett. I'm a mental health counselor in the United States. And you're probably here because you want to provide the highest standard of care to your patients. And that involves, of course, having good policies and procedures. And then that the staff, they understand the policies and procedures and they could actually implement them. So let me take a second just to introduce myself, let you know who I am. So in 2008, I opened up my private practice as a licensed counselor. And my very first client wanted sessions over the phone. So at that time in all of my schooling, I didn't learn anything about providing virtual services, which was really strange because it was being done, but we weren't taught about it. So I sought out training and I found that the training was pretty boring. It was just reading a lot of information and it left me with a lot of questions and it wasn't really easy to implement. So I got very, very motivated to provide high quality training that was truly practical, where someone can learn the information and the next day actually implement it. Because I've been in a lot of educational, universities and training programs that were really good. So that has been my focus. So I started training clinicians in telehealth over 16 years ago, and then started the Training Institute over 12 years ago. So that's where we are. Our focus is in telehealth training. Some of the ways that I've been involved with other organizations, just to give you an idea in terms of accreditation and standards. In the United States, we have an accreditation organization for rehabilitation facilities. And that's for physical rehabilitation, for substance use disorder rehabilitation. So I was on their task force to come up with the standards for accreditation for virtual services, for telehealth services specifically. And then you might be familiar with the American Telemedicine Association. I helped write their recent standards for telemental health. And then I've been involved in other organizations in the United States. So I understand that in order to really provide the highest standards of care, we need to have policies and procedures. And that's what accreditation is really helpful for, making sure that all the processes are in place. but then the staff actually have to understand them and be able to implement them. And that's where high quality training comes into play. So in terms of our the International Telehealth Organization that we're here with, we have endorsement for 3 of our training programs, and I'll show you those. Let me get back to the screen here. Oops, just had to share this correctly. Thank you for your patience. I'm juggling. Yeah, I'll do just screen 1. So one of the programs that's endorsed is our Telemental Health Training Certificate Program. And we've had this program for over 12 years. And so it comprehensively covers all of the essential competencies for telebehavioral health. So it's a 15-hour program. And another one that's endorsed is we have a telehealth training program specifically for directors, managers, coordinators in the telehealth arena. So if you're part of a large healthcare organization, like a large hospital system, and you want your telehealth director or manager or the coordinators for specific departments to be trained, this is a great program. We also have a telestroke facilitator training program. So how is it that you assist, say, a neurologist with conducting a telestroke assessment and treatment plan? But what we find is that it's important for the staff of organizations to know how to implement telehealth services specifically for your organization, because you utilize your own technology, you have your own unique policies and procedures. So sometimes if clinicians just take a general training, it doesn't really meet the objective for the clinicians to be able to implement what it is that they're implement the policies and procedures. So we also provide custom courses to organizations. We do this a lot. We provide training for many different, over 70 different university programs we provided telehealth training for. So we can provide custom training. And another thing that I wanted to share with you is we find that a lot of times when clinicians take a training, you may have experienced this. You listen to the training, you watch the training, it goes in one ear, out the other. There's not really practicing the skills and getting immediate feedback. And it's not really, the training's not customized to you specifically in your learning needs. So we also spent the last 2 years developing an AI clinical training tool. So this is where, like, as an organization, we can utilize your policies and procedures, and AI will utilize your specific policies and procedures, train the clinicians, and the clinicians will be able to practice scenarios. So for example, let's say one of your staff members loses their laptop computer. What do? What's the policy and procedure? So AI will walk them through different scenarios, and then the clinician will answer, and then AI will give immediate feedback, such as, yeah, you're right. You have to notify your supervisor, but you also need to do these other things according to the procedures. Or let's say they're meeting with a patient, and the environment of the patient seems really unsafe. What do? So they practice these scenarios. So rather than just going to a training and listening to information, they're really learning how to implement those policies and procedures and what they learned. So that's another tool that we've developed. So what I would consider is, in terms of your organization, is you have the policies and procedures, and are the staff informed, trained, and can they implement? So again, I won't keep us very long here. I don't have, say, a slide deck, but that's what we provide, and we'd be open to any questions.
Thank you. Thank you, Raymond. Thank you so much. I think wonderful work congratulations for building the skills in people, that's very, very important for any program for that matter, whether it's accreditation, certification, or education. So
Yep.
building the skills of individuals. So
Yeah.
congratulations for fantastic job.
Thank you. Can I share one more thing that I forgot to mention? We had a university that requested training for nursing. So we have a telehealth certificate program for nurses, and we are currently this month recording our certificate program for physicians, physician assistants, and advanced nurse practitioners. So if you have a need for a particular, clinical field, we'd be glad to hear from you. Thank you.
Great. Excellent. Thank you so much for sharing the resources and opportunities with our participants, and they definitely will reach out to you. So thank you so much, Raymond, for your wonderful talk. Moving on to the next, may I now invite Ms. Maya Sharne, General Manager, telehealth.org, talking about resources for evidence-based education, compliance, consulting, and professional certification. Over to you, Maya. Thank you.
Wonderful. Thank you all. Good morning. At least it's morning here in New York. I know we're all over the world. I want to thank the International Society for Telemedicine and eHealth. I know we're a little bit over time, so I'll try to move through this quickly, being mindful of everyone's time. As we all know, and as we've discussed, healthcare is constantly evolving through digital transformation, and accreditation in particular, as Raymond was discussing, plays a really vital role in ensuring that innovation is accompanied by trust, quality, and accountability, in addition to measurable outcomes. So today, I'd like to share how telehealth.org contributes to that mission by supporting healthcare professionals through accredited education, competency development, and workforce readiness, all related to virtual care. Telehealth.org is a global education and professional development platform dedicated to advancing excellence in virtual care. For more than 2 decades, we have supported both individual clinicians, healthcare organizations, universities, and healthcare leaders as they adapt to the rapidly evolving technologies, ever-changing regulatory requirements, and different evidence-based models of care delivery. Foundationally, our mission is pretty simple. Our goal is to equip healthcare professionals with the knowledge, competencies, and practical skills needed to deliver safe, effective, and high-quality telehealth services. And in many ways, our work aligns directly with the goals of accreditation. We want to establish standards, promote consistency, and support continuous improvement and professional growth, all while fostering trust across the healthcare ecosystem. We do that through a number of ways. We provide competency-based education designed to support both individual professional growth and organizational workforce development. We offer accredited continuing education, CE and CME accredited programs, professional certifications, and practical training that helps healthcare professionals apply evidence-based best practices in virtual care environments. We do this through self-paced modular learning experiences. The goal is to make education scalable, accessible, and adaptable to the needs of diverse healthcare professionals around the world. And we accomplish that because our programs, like Raymond also addressed, focused on real-world clinical practice, not just theory alone. We work alongside subject matter experts, researchers, and industry leaders to develop content that translates evidence into practice and helps establish new standards for telehealth competency and care delivery. And, as we've all discussed, and I think we all believe, digital healthcare is expanding globally, it's changing constantly, and workforce readiness it's becoming increasingly important. But the technology alone is not what creates quality of care. It's the competency of the professionals that do. And so this is where accreditation and education becomes essential. We support this through our telehealth.org ecosystem, but we are much more than just a course provider, even though we, do offer many different types of courses. Our ecosystem supports healthcare professionals throughout their digital health journey, and our goal is to promote lifelong learning in this evolving healthcare landscape. So this includes our on-demand continuing education programs. This is the CE and CME offerings. We also offer free live monthly webinars that focus on topics related to emerging issues and policy and evidence-based trends and clinical best practices. We have timely industry insights and resources that are disseminated through our website, telehealth.org news, and also through our over 50 newsletters that we send out every quarter. And we offer professional credentialing and workforce development initiatives as well. So together, all of these things, all of these resources create a continuous learning environment that helps professionals stay current on virtual care standards, on technologies, regulations, and the changing patient needs and expectations as they evolve. I want to spend a moment speaking about our BCTP program as this, we're discussing accreditation. One of the most important lessons we've learned over the last few decades providing high quality education is that successful telehealth and virtual care requires more than just technical knowledge and more than just theoretical knowledge. It requires consistent standards and demonstrated competency. And so we support this professional competency through our board certified telehealth professional program, which establishes consistent telehealth standards across diverse healthcare settings. This educational framework is built around interprofessional competencies that reflect the realities of modern virtual care. And through this, we emphasize flexibility, enable learners to access this education from anywhere in the world while developing consistent skills that align with evolving industry standards and workforce needs. We also do custom content based on different organizational needs, but the foundational standards for telehealth competency are consistent regardless of what your profession is, regardless of what your specialty is. Most importantly, we bridge the gap between learning and implementation by focusing on practical application, measurable outcomes, and real-world clinical relevance. And through the oversight and collaboration with our expert education advisory board, telehealth.org maintains a best-in-class certification framework that prioritizes quality, credibility, relevance, and continuous professional development and improvement. So what sets us apart from some of our competitors, some other, certification programs, some other education platforms? In speaking with healthcare organizations, universities, and clinicians who are our customers and our partners, we know they choose telehealth.org because we focus on outcomes rather than course completion alone. We believe education is only valuable when professionals can apply what they learn into practice. And that philosophy is reflected in every step of our instructional design, our quality standards, and our commitment to translating foundational knowledge into meaningful clinical and operational outcomes. Our programs are designed to scale across teams and organizations, although they can also be taken by individual providers. But they support workforce development at both the individual and systems level while helping standardize the competencies among clinicians, administrators, and healthcare leaders. And lastly, we remain unwaveringly committed to long-term professional growth and continuous quality improvement. I know that these are principles that are shared by accreditation bodies across the world. So as we celebrate World Accreditation Day, I think it's important to recognize that accreditation is far more than just a compliance exercise or this box we check off so we can get a stamp on our website. It is really the catalyst for innovation. It is the catalyst for professional development and improved patient outcomes. It creates trust among patients, among providers, regulators, educators, and healthcare organizations, and supports the sustainability of digital health by ensuring that the quality keeps pace with the rapid technological advancement. At telehealth.org, we are very proud to contribute to this mission through accredited education, competency development, our professional certifications, and workforce readiness initiatives. And so I'm excited to be speaking with you all today. I look forward to the opportunity to collaborate with different organizations around the world with the shared mission to advance safe, effective, equitable, and sustainable virtual care for everyone in the healthcare space. So thank you all for your time, for staying a little bit later. I really appreciate it.
Thank you very much, Maya. Thank you for a very quick and very crystal clear presentation on how telehealth.org is supporting the care for virtual care, basically for the patient. So thank you very much. We have been monitoring the chat box. We didn't find any questions. I think everyone was very clear and crisp in communicating and presenting the message to the participants. And I think we are also in running of time. So may I now request friend Frederick Levens, the Vice Director, Executive Director of ISfTeH, for closing remarks and vote of thanks. Over to you, Frederick. Thank you.
Thank you very much, Bhupendra, and thank you to all our speakers today. Thank you very much for your time and your contributions. Thank you to the participants for joining us. I think one of the aims of today's webinar was also really to give some insights into the resources, let's say the people and the organizations we also have in our network, of the International Society for Telemedicine and eHealth as members who are involved and providing services in this area of accreditation, certification, standards, and training, CME, etc., to spotlight these people and organizations. And I think we have succeeded very well in that. And so anyone in the telehealth space, and as we heard in the course of the webinar, whether you're a small organization or a very large institute, healthcare provider, etc., there is something for you in there. And if you want to assure the quality of your programs, or if you're not quite sure as to how to set up a new telehealth service, these types of organizations that provide accreditation, that provide training, are there for you to help you set some of that up, or to make sure you're adhering to certain standards and assure quality services, because telehealth, remote patient monitoring, etc., has now been around for a long time, but there is still a lot of growth potential, and certainly with new players coming into the market, it is important that they also follow the quality guidelines so that patients can receive safe, secure, good quality services. So thanks again for this. If any questions after listening to this webinar, feel free to reach out to us or directly to the speakers you have heard today. And there will be more initiatives on this topic in the future. We actually have an accreditation initiative within the International Society for Telemedicine and eHealth. Dr. Bhupendra Rana from QAI is leading that, and in that we're trying to bring together the people you heard today, but also other members who are active and involved in this area, to collaborate, to exchange, and then obviously also in the end to reach out to other members on the service provider side, so that they can be assisted in their journeys. So thanks again, everyone, and we look forward to seeing you next time.
Thank you.
Thank you.
Bye.